Senator Udall.
Thank you, Senator Feinstein. Good to be here with you. And let me just thank you and Senator Grassley for focusing on a tremendously important issue. I mean, this testimony we've seen, this chart that I think was in your package, this astronomical growth is it's just astounding. And in light of Senator Klobuchar's discussion with me, I first want to turn to you, Doctor, and ask you on the prescription drug monitoring issue. I think you wanted to say something there, and so I hope that you have an opportunity to do that.
I did. Thank you for asking me. Most states, as we've heard, have prescription drug monitoring programs, and we can invest in interstate data sharing, but unfortunately, they're not being used. The PDMPs may be one of the best tools we have in the country for bringing this crisis under control, and except for New York, Kentucky, and Tennessee, the 3 states that made it mandatory for doctors to use them, they're just not being used. So if there's some way that you can incentivize states to make it mandatory for their physicians to use them, I think that would be very helpful.
Use what?
Prescription drug monitoring.
Oh,
The doctors.
well, we ought to do that.
Yes.
I mean, that's something we can do.
Yeah, and that's what you're saying we should do. We should make that mandatory.
Absolutely.
Yeah, right.
Unfunded mandate.
A worthwhile one, though. Worthwhile one. Let me, and I had an opening statement too, but Madam Chair, I'm just going to ask to put that in the record and go on to questioning, because I think such good issues have been raised here. Last month, and this goes to Dr. Renzizi, last month, I don't think you are a doctor, but anyway, last month, Senator Portman and I sent a letter signed by 14 of our colleagues to Attorney General Holder, urging the Department of Justice to draw on the many evidence-based strategies that are being successfully employed in states to address heroin and opiate addiction, the opiate addiction epidemic. Can you explain what efforts are underway to find solutions that are working in the states and then expand them nationwide?
I think for starters, the states have taken the lead in having prescription drug summits, not only for the prescribers, pharmacists, nurses, but also for community leaders. The states have basically leveraged their community coalitions and have the community coalitions out there doing education. Using that as a force multiplier, we get the word out to our schools. I think the states are doing a remarkable job. We're working together with these in investigations related to rogue pain clinics and rogue practitioners. I think that this problem, if we don't work as a team, both state and federal, local investigators and regulatory boards, it's just going to get worse. And we are. We have more collaboration with regulatory boards and state and local task forces now than ever before, just to address this problem. Florida is a perfect example. So I think the states and the federal government together are doing a fine job addressing the problem.
Well, the great thing about our system is having the states as laboratories, and as you said, they've come up with some very good examples that I think we can spread nationwide. Dr. Botticelli, drug abuse, I have a very large Native American population, 23 tribes in New Mexico, and drug abuse in Indian country is a significant problem. According to a SAMHSA survey, the rate of non-medical use of prescription drugs among American Indian or Alaska Native adolescents was almost twice the national rate. And during fiscal years 2006 and 2009, the High-Intensity Drug Trafficking Areas Program provided a small amount of discretionary funding for a Native American program to combat drug trafficking on tribal lands. Is this something you'd be willing to consider as director?
Sure. We've been significantly concerned in terms of substance use, and particularly this issue on tribal lands. We've actually been working with the Indian Health Service to look at how they might increase capacity around medication-assisted treatment. We've also actually gotten great cooperation from the Indian Health Services in making sure that all of their prescribers are appropriately trained on safe prescribing. So we've got great coordination with that. But we're also working, and we will continue to work with our HIDAs about how we might look at discretionary dollars to focus on that population.
Great, thank you very much. And that's a perfect, I think, collaboration between the Indian Health Service and you to move this whole issue forward. Thank you very much, Madam Chair.